seeCOLe was born in 2018, which stands for See Clinical Data on Lens. The use case was to allow physicians such as myself to be able to interact with the electronic health records by the use of our voice and by using FHIR APIs. As time progressed, Mary was born, which stands for Medical Analytics and Research Systems. Mary, we consider it seeCOLE on acid. It is an AI intelligence layer that sits using also Iris for Health. And clinicians such as myself can interact with it by asking for information such as, can you tell me the clinical history of this patient? Are there any allergies? And Mary is a clinical evidence-based intelligence and does not hallucinate and gives facts. What Mary can do, which is very interesting, it can give me trends. I can say from the age of 18 to 25, from the year 2000 to 2025, tell me patients who have HbA1c greater than 7. It will search all of the electronic health records. It will give me a whole trend graph so that I can see what is occurring throughout time. The benefits for clinicians is that it saves us time. It's been shown that we would save somewhere around 400 hours per year, which allows us either to have more free time, see more patients. It allows us to improve our efficiency because we no longer have to click, sitting at workstations, looking for workstations, and clicking away through all the electronic health records, which can be rather tedious. Now, with the use of Mary, we improve our efficiency, we improve our quality of care, and we can be at the forefront of all medicine.
So at this time, I'm going to show you how Mary works. And as Dr. Sherry had mentioned here, we're going to show how clinicians like herself can save time utilizing our medical assistant and research system. So Mary can be used on any sort of device. Right now I'm using it on a tablet, but it can also be used on your mobile device and also on your laptop. It's not a native app, so it's all web-based. Okay, and so from here, just like you would in the real world scenario, a provider, when they're coming into the room, will identify the patient. So at this point, I'm going to identify my patient. Right now, we are using Epic Sandbox. And as Dr. Sherry said, this sits on, it's powered by Iris for Health. Dwight Hill, born August 24th, 1984. Once the system identifies the patient's name and date of birth, and now it gives me a confirmation about the patient. Now, providers like Dr. Sherry can ask pinpointed questions such as, I need a complete clinical summary on this patient. Typically, something like this would take various screens and it would take a lot of time, but in under a minute, you'll see how Mary can pull FHIR data, clinical data from the chart, reason with it, and be able to articulate it to me in a way that's in my native language.
This patient's clinical history includes active conditions, type 2 diabetes mellitus without complications, diagnosed on March 7, 2026, obesity, body mass index 30+, diagnosed on...
Lastly, I'm going to demonstrate how Mary, not only can I review trends or how I can retrieve clinical data, but also do actionable items such as writing a prescription. Let's write an order for acetaminophen 350 milligrams by mouth and instruct the patient to take it once a day for pain. Okay, now what Mary's going to do is a drug-to-drug check.
Mary can order acetaminophen 350 milligrams by mouth once a day for pain. Shall I proceed?
And now once the provider, such as Dr. Sherry here, gives her verbal confirmation, now this goes right back into the medical record in real time, waiting for the provider to click their final signature. Yes, please proceed. And now all the FHIR data is processing the order, and now that goes back into the chart in real time. One thing I do want to point out is that if English is not your native tongue, Mary can also speak and also can understand various languages as well.
What's also very important that needs to be mentioned is that Mary was built with governance in mind. Mary will not act on its own. Mary will ask for confirmation. Mary has an audit trail log where it's timestamped who has placed the order, who has confirmed to place the order, and have an audit trail that is HIPAA compliant and can be followed through if needed.
So you just got a sample of one of our solutions, Mary, which is our most recent solution in which we're eager to push out to all InterSystems Iris for Health clients. Now I'm going to introduce our legacy application that we introduced in 2018. And it's seeCOLe, which stands for to see clinical data on lens. And the use case here is for isolation rooms, patients that are rounding, surgeons, any clinician that really wants to free their hands and also interact with the clinical data. So I'm going to give you a brief demonstration of how this works. So the first thing is that the clinician would wear a pair of augmented reality glasses, such as the View 6 Blade. The second thing is that once again, we're going to play with fake patients in Epic Sandbox. And to do that, it needs a two-auth security step. And the first would be a QR code dedicated to the end user. A second would be their verbal password. For demonstration purposes, we eliminated the password, but in a real world scenario, a clinician would say their dedicated password and then the program would start. So let me start this demonstration. So now I'm going to scan the patient's armband. And once I hear that tone, I know that I made a connection into the medical record. On the upper left-hand corner, you can see the patient's name, date of birth, and their sex. And if I wanted to see other aspects of the record, all I would need to say is simply vital signs, if I wanted to see that. And within seconds, now you can see that I'm accessing that information. So thank you for your time. What you just saw is some cutting edge technology that we're introducing to all Iris for Health clients. With seeCOLe and Mary, once again, our use case is not to replace the EHR, but just elevate the EHR experience. No longer clinicians have to click or have to carry a workstation on wheel to interact with the medical record.
Please feel free to go to our website and book a demo. And we're also looking for pilot sites. So please reach out to us at any time and we'll be happy to walk you through all our process. It's simple, we're fun to work with, and you'll enjoy Mary in the long run. Thank you.